Hi, everybody. Welcome back to the group psychology series. In this particular lesson, we're going to talk specifically about the pre-group meeting and some of the benefits and whatnot. Now, I will tell you that in an earlier lesson, some of this is covered, but redundancy is a good thing, especially in clinical courses. So I might be a little bit redundant, but it will also help as we move forward. So, uh, our general learning objectives are as follows. So, I want to list and discuss the various tasks or the main tasks in forming a group. I want to address some of the approaches to group formation, such as recruiting, screening, and selecting members. I want you to understand various practical considerations when forming a group, the various purposes and uses of a pre group meeting, and address some of the co-leadership issues that could occur. Now, what I want to impress upon you is that investing time and energy into the preparation phase of a group will most likely be well worth it in the long run. In this lecture, we're going to review various decisions that need to be made even before the group meets. So it should provide guidelines for developing group protocols, negotiating sensitively with staff at an agency or an institution that will help you get your groups off the ground. So we'll also talk about practical considerations such as uh, group composition, size, duration, length, meeting place, and the issues related to attracting and screening prospective group members. We'll also review the benefits of holding pre-group meetings for the members. And what I will tell you, the biggest point is that research suggests that pre-group preparation is positively associated with group cohesion, member satisfaction, and comfort within a group format. So, meeting in advance allows members the opportunity to explore their perceptions, concerns, and expectations, as well as the opportunity to learn the basic ground rules before the group starts, which is likely to decrease anxiety. I can't tell you how important this point is. Oftentimes, without this pre group meeting, your group members might enter a group setting with an unrealistic expectation, such as the amount of time they might be afforded to speak on a various topic, on a given topic, and whatnot. So it also will reduce anxiety because you will talk to them and say, hey, you have the opportunity to share, but you won't be forced to share if you don't want to. What we ask of you is that if you're not comfortable sharing, at a minimum, just state the emotion you're feeling at that point. So you don't have to share why, just what you're experiencing. I also want to tell you that the leaders themselves can benefit from pre group preparation. And the primary reason why leaders can benefit from pre group preparation is that there might be differences in styles and how people approach group therapy. And that could complicate the group process. I can't tell you how uh, bad it looks to group members if the co-leaders are stepping on each other's toes and it looks like they're not with one voice. So it gives the co-leaders an opportunity to discuss their leadership styles, their philosophies of group, and all of these could result in a better group outcome. Now, groups are being created in a variety of group settings to fit the unique needs of diverse clientele. So, when we think about this, there are groups everywhere. I facilitated a group in my postdoc, and I worked at a senior care center working with older adults. And it was in a long term rehabilitation center. So you could imagine that the individuals who were put into my group were not at the same level. Their even their cognitive abilities were at different levels. So people go to long-term rehab centers for different reasons. But some people who were younger might have had a traumatic brain injury. Some people older might be there due to regular aging and health concerns. And then you had people with neurocognitive disorders, all in the same facility. And when I did my postdoc, one of the requirements was to run groups for this community. And I struggled, to be honest with you, when I think about how we started. Um, there were different cognitive ability levels. So, and because there were individuals who were Medicare, the groups had to run 90 minutes. So you had people who were sometimes nonverbal post stroke. You had people who uh, had memory issues and whatnot. And I was like, wow, how am I going to run this group? And then you had a whole nother group of people who were part of this experience who were lucid and they were just aging and had complex medical issues, but cognitively they were there. And I remember speaking to my supervisor and saying, I don't know if this group composition makes sense because you have high functioning, highly verbal individuals put in the same group as people who are lower functioning or nonverbal. And I asked the supervisor if it would be possible to have two separate groups. However, because it was a rehab center, they could not give me 3 hours a week for people to be pulled out. So I was kind of stuck. I was kind of stuck with, how am I going to do this? Because I had to put a heterogeneous community together, which is fine. And what I thought was I'm going to work using photography, or I titled the group Developing a Greater Awareness of Oneself Through the Arts. And what I did was I kind of mentally, I separated every group into two mini groups. And half of the group included some kind of expressive arts activity, such as photography. One week I rented disposable cameras and I took all the residents up to the roof of the facility and they could take pictures of the flowers. They could take pictures of one another. They could take pictures of themselves. Uh, and then the second half of the group was to verbally process what they experienced, and then there are other drawing exercises, drawing uh, one's view of oneself and talking about what that means, what their artwork meant for their experiences in life. So each group had to have two elements: a nonverbal piece, which was very performance based, very hands on, artsy based. And the other half was very much verbal. And that allowed me to make sure that when I wrote my group notes, which is a requirement when billing insurance companies, that each individual could have unique targeted goals and outcomes. So I share with you this because when you think of group therapy, I don't know if you think of long term rehab centers and then the unique challenges that you're going to have to address or work around to make sure that the group is functional. So that's just one example. And when you do your practicum, you're going to you're going to experience some of this yourself. But I wanted to share with you, sometimes you have to be creative. Now, groups have become incredibly popular, and the goal is obviously to meet the needs of your clients, but also the demands of agency settings. So, a long-term rehabilitation center is an agency, right? It's what people call nursing homes, but it's now been referred to as rehab centers. But it's an agency setting, so you can't just focus on the needs of your clients. You also have to focus on the agency needs and demands of the setting. And you have to be creative too. Another creative thing that I did was I always offered sweets. So I would go down to the cafeteria and I would ask the chef to put together a platter of pastries and coffee, which was a treat for uh, individuals in a residential center or rehab center. So they had additional perks relative to their peers. So that also incentivized some people to come. So you really have to be creative about how you get people there and how you work on things. Now, I think we talked a little bit about the group proposal, but a group proposal is absolutely key to translating your ideas into action, right? So the for many classes, including my group counseling class, I require students to write a group proposal. But there are 5 specific areas that you want to target: the rationale, the need for the group, so the objectives, what you intend to accomplish during the group, any practical considerations. So for me, it was cognitive abilities, verbal abilities. These are practical considerations. Procedures, how you intend to accomplish your goals, and any important interventions. So discovering oneself and their sense of self through photography or arts is one 2 different examples of how we would figure out who we are. And then at the end, you have to strategize how you're going to assess your outcomes, which we've talked about. But it's good even before you run the group to be thinking about how you're going to assess your outcomes, because otherwise it becomes a moving target and you could say your group accomplished more than it actually did. Now, attracting and screening members. So the type of groups determine the kind of members that are suitable or unsuitable. So you want to think about who you're attracting and how you're going to screen people out. So when you're screening members, you should ask, should this person be included in this group at this time with this member? Now, that question actually has 4 parts. You want to focus on the person themselves. You want to focus on what the purpose of the group is at this time, whether they're ready for a group, and with the leader. Now, we talked about in a previous lesson about how the group leader shapes the group and how their theoretical orientation plays a role in all of this. So, is it possible that this individual could benefit from group at this time with another leader? Maybe. But all 4 of these things, if the answer is yes to all 4, you're going to admit them. If the answer is no to some of these, now you have a tougher decision to make whether you're going to continue to allow that individual into the group. What methods of screening are you going to use, right? So, are you going to do a pre screen over the phone? Are you going to have them fill out a personality assessment before they uh, participate? Are you going to have them show up and talk to you about their purposes and goals. There are different ways to screen, and a lot of pre-screening happens today over the phone. Um, I'm not particularly a fan of that, but nevertheless, people do it. And in this post-COVID world, it's going to happen even more. So it's something to think about. And how can you determine who may or may not benefit from a particular group, right? You want to think about how are you going to sift through the candidates, and how would you deal with someone who you deem not suitable for your group? And there are different ways to handle it. Most of us in this line of work have colleagues who also run groups, and we might explore with our colleagues if they're running a group that's best for this individual. We also might say, well, even though you're not suitable for this group or any groups that I'm offering, I can offer you individual therapy if you're interested, or if they're needing a higher level of care altogether, you might mention that to them, that at this particular time you feel that they might not benefit from group therapy as much as individual therapy, and push back a little bit so that they don't just jump into a group with someone else. Now, the group composition we talked about as well. So some of these slides are a little bit redundant, and I apologize. But group composition, we talked about whether you want a group that's homogeneous or heterogeneous. The more homogeneous a group is, the more likely you're going to have group cohesion. So that's something to think about. Now, group size, I always recommend anywhere between 8 to 12 participants is good. The frequency of groups, the standard frequency of groups is once a week. Now, I have seen people run groups that are more frequent than once a week, but that's less common. It could be, if people can afford it, that they might want a greater frequency. So in some high-end independent practices, they might have groups more than once a week. And the duration of the session, as I've mentioned, they can range between an hour to 2 hours, but most groups settle in at anywhere between 60 minutes to 90 minutes. So you want to be mindful of the duration of each individual meeting. And then the length of the group. The length of the group is kind of up to you. If you have specific targeted interventions, you might end up with a 12-week group, and that's it. And that's fine. And each week you engage in one psychoeducation activity or another. Actually, this is a good example. When doing my pre-doctoral internship, I ran another group for individuals who had a combination of substance abuse as well as mental health issues. And the focus of this group was anger. So they also had to have a history with anger and aggression. And this particular group went 12 weeks, and each week had its own focus, and there was a strong psychoeducational piece as well as an experiential piece in the group, but you always had something you wanted to impart upon them or teach them before you opened it up, such as some icebreakers we use is, what's the difference between anger and aggression, right? So people think anger is bad, but anger is not bad. Anger is an emotion. Everybody gets angry from time to time. But the difference between anger and aggression is when that anger is not contained and you engage in an act that's intended to harm or destroy. So it's okay to be angry, but it's not okay to harm other people, whether it be physically, verbally, or otherwise. So that might be the beginning discussion to talk about, okay, can we get a hold on the difference between anger and aggression? Now, you also want to think about the place for group settings. That makes a difference. So, we talked about some groups that are more frequent, independent practice. They might be in someone's treatment room or their office, but I've seen groups run a whole host of places, right? I've run a group in a boardroom before, I've run a group um, on the roof of a nursing home or rehab. But the place that you run your group session also has some things you want to think about. Safety for the participants. You want to think about distraction issues. You want to think about mobility. I've seen some colleagues rent out space in churches or houses of worship in the basement, and that really isn't very wise. I don't recommend that because many of these basements are not accessible. So if you have an individual who's a good candidate for your group, but they don't have the level of mobility, you might run across some ADA issues, you know, Disabilities Act, American Disability Act issues. And then we talked about this, but open group versus closed group. So open group, again, you have changing membership. There's no specific end time, and people are allowed to enter at any point or leave at any point. Open groups are very valuable, especially in inpatient facilities. In inpatient facilities, people are not going to be with you for extended periods of time. In fact, the average stay in an inpatient hospital is anywhere between 14 to 21 days. People don't stay in a psychiatric hospital forever. So if you're going to run a group, you want to make sure that it's a group that um, people who come, they can get something from the group even before they leave, even before they're discharged from the hospital. So that's an open group. It happens a lot in inpatient settings. It also happens in high-end independent practices where people want to stay in a group for a long period of time, or I don't recommend it, but sometimes people talk and they recommend their friend come to a group or whatever. There are dual relationship issues and boundary issues when that happens. But sometimes you don't know. Someone contacts you and says, "Hey, I'm interested in a group," and you don't know off the bat whether they're friends with another member. So, but open groups, people can come in, people can leave, and there's no end point in, you know, pre-established. Closed-ended groups, you have the same people for the lifetime of the group. So the anger management group, that was 12 weeks. I started and ended with the same people. That's it. It was an outpatient community mental health center that I was running that group in. So and it was time limited. So 12 weeks. Oftentimes help these individuals for um, if they had to get a letter for the courts that they were part of this group. These were closed. And if someone wanted to join in the middle, they would have to wait for the next cycle. All right. Some advantages of a group. Well, groups allow you the opportunity to explore new behaviors and experiment with new behaviors. Groups also serve as a microcosm of the real world. So, how you behave in the real world is likely how you're going to behave in the group, and vice versa. So, how you behave in the group uh, is sort of like on a small scale what things look like in a real world. So it goes both ways, and it allows you to discover how you're perceived and experienced by others. I can't tell you how often people have a self-serving bias or a overly positive view of the self, but when you're in a group setting and the group is a functional working group, your peers are going to challenge you. They're not going to just agree with you, and they might let you know that they see you very differently. Um, Additionally, allows you to know you're not alone in your concerns. So most groups, especially homogeneous groups, you have 8 to 12 people dealing with the same or very similar things. So you don't suffer alone. You don't struggle alone, and you can avoid the statement, "Oh, nobody gets me," right? Because you have other people experiencing the same thing. Now, I will clear up some misconceptions. Group is not suited for everyone. So it's very important that you, in this pre-group meeting, that if someone's not suitable for group, that you don't force them into a group. Another misconception is the goal of the group or main group is to achieve closeness. Group therapy is about working on your issues. So it's very important. You don't have to like the members of your group, although, I like to explore why you don't like another member of the group or what they trigger in you and why. So if you don't have closeness with a member, I want to know what that's about. But you don't necessarily have to be close. It's you are in a therapeutic relationship, not a personal friendship. So these individuals may be friendly, but they're not your friends. So if you feel close to them, great. But if you don't feel close to them, and you're wondering why not, I might ask you, well, why do you feel a need to be close to them? And we might explore that. So another misconception is groups tell people how they should be. That's absolutely false. In group therapy, we actually help you explore what you think you should be. So instead of me telling you how you should be, you might tell me what you're unhappy about yourself and how you want to be. So what that does is now you're the expert of on you. Uh, Now, an additional misnomer is that group pressure forces member to lose their sense of identity. That's also not true. The whole purpose of thinking about group size is to make sure that it doesn't get so large that people get swept away in the group. You still have a sense of individuality and voice within the group. So that's why the magical number of 8 to 12 is out there. And groups are artificial or unreal. It's not true. You will see when you run groups that, as I said, it's a microcosm of the real world. Some real stuff comes out in groups. All right. So, what are some of the uses of the pre group meeting? So, now we're starting to really do a deep dive in the objectives. So, the uses of a pre group meeting include establishing a time for setting expectations, ground rules, procedures, role preparation, and skill building. So, uh, you want to make sure that your participants' expectations of group are in line with the goals and objective of the group. You also want to talk about group roles. And, you know, we touched on this a little bit, but what's your take on people being late or subgrouping, which is to talk about things outside of the group with other group members? Or what's your take of cell phone usage, or if a person wants to leave group? Now, it's interesting when I um, run a group, especially if it's an open group where people can come and go. I like to have people commit to 3 sessions before they terminate prematurely. And one of the reasons why I do that is there's an adjustment process, and you want to see if, maybe the group is for you and you're a little bit slow to warm up. So if people want to terminate prematurely, I ask them to give it 3 sessions. And if they still want to drop the group, that's perfectly fine. Um, I also expect people to, if they are going to leave the group, to let the other members of the group know. That's very important so that people don't just wonder why there's an empty chair, um, and so forth. So another use of the pre-group meeting is to talk about clients' perceptions, expectations, concerns. I like to focus a lot on the concerns because there's been some research that talks about when you talk to an individual's anxiety and their concerns, they're more open in group. So you want to address any of the concerns that a person might have. And all of these pre-group meetings, like, and if you target these, it's associated with increased group cohesion, member satisfaction. People are more likely to participate. Um, they're more likely to um, participate in offering aspects of informed consent. And it's just a standard practice, especially in short-term therapy. So, goals of the pre-group preparation. You want to demystify the therapeutic process, and that's central to preparing members of group. So you will talk about, well, in my group, here's how I approach it. And you might talk about your theoretical orientation so that they can know what to expect from you. You might also talk about how the group is likely to enhance their interpersonal relationships, because a group, as we said earlier, is a microcosm of the rest of the world. So the way you communicate in group, it's not like you don't remember that. Once therapy happens, it happens. There is going to be some carryover outside of group as well. And then in the group meeting, it's very, very important to encourage people to ask questions about the purpose and the goals of the group. So it's not just a monologue, that should be a dialogue or a bidirectional exchange between the group leader and the group members. Um, that you want people to anticipate any frustrations or disappointments they might experience. You want to instill faith in group work or establish procedures for group process. And you want to talk about confidentiality to the extent possible. Now, building evaluation into group work. I have colleagues who, at the end of any of their sessions, they have all of the members of the group do a rating scale on the group, as well as the group leader. So that rating scale gives feedback to the group leader how closely they hit the mark, or if they were off the mark. That's also important to know. So federal and state grants typically require you to do an evaluation and explain how you're going to assess the group. You also want to evaluate both individual group outcomes as well as the general group. You might recall earlier in this presentation, I talked to you about how when you write a group note, you don't just write one group note. You write a group note for each of the individuals in the group, especially if you're billing insurance, right? So when you write that group note, you have to talk about, well, what are you accomplishing with that individual, or how they're reaching their goals. You also can include qualitative measures such as mental status exams, mood and affect, things like that, it isn't just what they did in a group, it's how they express themselves in the group. And then, that's crucial. Now, I mentioned to you that co-leader issues occur within groups. So you want to make sure that you're sharing equal responsibility in forming the group and getting it off to a strong start. I say this in relationship work, but it's relevant to co-leading groups as well. A relationship is strong as the person who wants it the least. So a group leader dyad is as strong as the person who's committed to it the least, right? So you want to make sure that both of the leaders are equally responsible or committed to the group. You also want to encourage meeting in advance of the group whatever week that is or time it is, and talk about, well, in this group, what are we trying to accomplish, right? With the time you have, and how are you going to meet your objectives? You're going to talk to one another about your approach to leadership style. And if there's a difference, you might come to terms with, okay, well, who takes the lead in what? So if it's group process and someone is more dynamically inclined, they might be stronger at exploring group dynamics. So you might say, well, because that leads to your philosophies of group and your leadership style, you take this on and then I'll take this on. And when you do that, the group functions much better. So you have to have a working relationship with one another. You have to spend time getting to know one another. And when you do that, you're going to uh, predispose your group for success. And your group members feel it. I think I said to you, if the group leaders are not on the same page, your group members will feel it. So you don't want that. Now, in the next few lectures, we're going to talk about the stages to follow. This was just a pre-group meeting, but the 4 stages that are to follow is the initial stage, which is orientation to group, getting acquainted, establishing trust, defining one's personal goals, and it tends to be very superficial in the initial stage. But then you go to transition stage. Now people are starting to show some of their inner dynamics. You're starting to see defensiveness, resistance, anxiety, issues, control, interpersonal conflict. You're starting to see some of the reasons why the person's in the group and how they can benefit, right? So in the transition stage, you can see some maladaptive behaviors manifest, but that's okay. Those maladaptive behaviors is why they're in the group, and you could actually help guide them through that in the group, and then that can carry on into the real world. The working stage, this is where there is greater commitment among the members to deal with any significant problems. There's more in-depth self-exploration. So at the working stage, it's no longer superficial. You're really focused on your growth. You see increased self-disclosure, you give each other's feedback, you receive feedback, you focus on the here and now interactions rather than past stuff that might have occurred. And last but not least, the final stage, which is the termination stage, is where you help groups consolidate their learning and help them take it from the group into the real world. Now, we're going to have a deeper dive in all 4 of these, but I wanted to use this as an intro to those 4 stages that are to follow. So I'm going to stop there and I'm going to stop the recording, but I hope that this helps you a bit. Take care, everybody.